Assalamu alaikum class. Today in this lecture we're going to talk about diencephalon. And before I start this topic specifically, let me just tell you something about diencephalon. So when we talk about the cerebrum, so your cerebrum is further divided into two major regions. One which is known as the cerebral hemisphere, that's also called telencephalon, and the cerebral medulla, or the structures are deeper in the cerebrum. They're known as diencephalon. In today's lecture, the topic of concern is diencephalon. So diencephalon is basically, if I, for example, remove this ink marks here, we try to make a brain here. So if this is the brain, so there's a structure that's called corpus callosum. Now this corpus callosum is basically a fiber which is responsible to connect to the right brain to the left brain. So everything underneath the corpus callosum is basically diencephalon, and everything above the corpus callosum, these are basically the cortical areas of the brain, known as the cerebral cortex as well as telencephalon. It's okay, sorry. So today we're going to talk about diencephalon. So diencephalon has a lot of structures, but out of those a lot of structures, there are only three major things that you need to know in details about. One is basically known as the basal nuclei, also known as basal ganglia. Then we have internal capsule, and then we have thalamus. So we're going to talk about these three major structures and their functionality in this lecture. So first, we're going to talk about basal nuclei, the gross features of it, the components of basal nuclei. We're going to talk about the connections. We're going to talk about the pathways. And then we'll shift to internal capsule. We're going to talk about the gross features of the internal capsule and the pathways which are running from the internal capsule. And then we'll just need to know the names and the function of the thalamic nuclei, which is important for your exam. So before I go, let me just give you a little bit of orientation of the structure. So if you look, all these three structures arranged in a fashion in the diencephalon. So अगर हमको coronal view में देखें, so we have right in the center we have the two thalami. This is right thalamus, this is left thalamus, and both of these thalami are basically connected together with each other through interthalamic connections. These are the interthalamic connection. Sorry. So if I go lateral to the thalama on each side, so I will have half X shaped pathway, which is basically known as the internal capsule. So this is the internal capsule. So this would be the anterior limb of the internal capsule. This would be the posterior limb of the internal capsule. And the angle where we have it, this is known as the genu of the internal capsule. And if I go further lateral to the internal capsule, this is where my basal nuclei is present. This would definitely be a caudate nucleus, which we'll just talk about in a while. So that's the orientation. So I can complete it here as well. This would be the internal capsule, and this would be the caudate nucleus. So that's the origin. So whatever the descending or ascending tracts are coming, either they will have to enter into the internal capsule, they can go to the thalamus, and from thalamus they can go up to the cortical areas of the brain. And the descending tracts which are coming, for example, right here, so they run through the internal capsule, and then this basal nuclei acts on it and makes it a proper signal. So that's the functionality of it, that's the orientation of it. So let's just talk about in details the anatomy of basal nuclei. So basal nuclei is known as basal nuclei because central nervous system में तो nuclei कहलाएगा. पहले ये concept नहीं था तो इसलिए ganglia बोलते थे इसको. अब ganglia नहीं बोलते, but किताबों में आपको ganglia bracket में लिखा हुआ मिल जाएगा. This is exactly the same. All right. So first we talk about the basal nuclei. Basal nuclei is basically a group of nuclei which is present in the diencephalon and on each side of the internal capsules, as I just told you about. So if you talk about the components of the basal nuclei, it contains the caudate nucleus. So I'll show you the caudate nucleus right here. The caudate nucleus starts from here. So this is the head of the caudate nucleus. This would be the body of the caudate nucleus, and this would be the tapering tail of the caudate nucleus till here. And then if I'm going here from the caudate nucleus, I will see another nucleus known as the putamen. And right next to the putamen, we have globus pallidus. So collectively, the putamen and the globus pallidus are known as basically the lentiform nucleus. And if you look at the tail of the caudate nucleus itself, it goes all the way when it's attached to another nucleus known as the amygdaloid nucleus, which is also the component of basal nuclei. So if you talk about the amygdaloid nucleus itself, the amygdaloid nucleus is responsible to connect your basal nuclei, which is acting on the motor skills, to a limbic system, which is basically which has the emotion center as well as the memories. तो past experiences से memories से हमारे actions जो control किए जाते हैं through basal ganglia, उसमें amygdaloid nucleus का बड़ा काम. All right. So let's talk about another classification. जो मैं आपको बताया, this is from the neuroanatomy book. Basal ganglia is further divided into corpus striatum and amygdala. तो amygdaloid nucleus मैंने अलग कर दिया. Corpus striatum में क्या आता है? दो चीजें आती है. न्यू स्ट्राइटम आता है, पेलियोस्ट्राइटम आता है. न्यू स्ट्राइटम को हम स्ट्राइटम भी बोलते हैं. इसके अंदर कॉर्डियड एंड प्यूटामेन आता है, एंड पेलियोस्ट्राइटम में ग्लोबस प्लैटिस आता है. एंड एज आई जस्ट टोल्ड यू कि प्यूटामेन और ग्लोबस प्लैटिस को आप मिला दें, that's lentiform nucleus. So lentiform nucleus is basically a connection between the neostriatum and the peliostriatum. तो जब हम फंक्शनैलिटी पढ़ेंगे तो आपको समझाऊंगा कि इनकी कनेक्शन का क्या फायदा है. आगे चलते हैं. Now, if we talk about the chordate nucleus, as I just told you, it has head, it has body, it has a tail, and the head is right here. Clearly see it's connected to the putamen itself. The body is right here, the parietal lobe, while the tail all the way goes to the temporal lobe. So these are the things that you'll see in the next slide as well. So head is rounded in shape, as you just can clearly see it. It lies anterior to the thalamus. ये पड़ा हुआ thalamus. It's right anterior to the thalamus, and it's completely separated from the putamen by the internal capsule, except rostrally where it is continuous with the putamen. So this is where it is continuous with the putamen. But जितना मैं पीछे जाता हूँ बीच में gap आता रहता है, because यहाँ से fibers run कर होते हैं of the internal capsule. Here it is. You can clearly see it. My diagram. This is the head of the chordate nucleus. This is thalamus. This would be your globus pallidus, and this is your putamen. So आगे से बोले मिले हुए होते हैं, but यहाँ से देखें बीच में gap आ गया. This is internal capsule. This is exactly the point which I was trying to draw in my first slide. So I hope the orientation is good now. When we talk about the body and the tail, body is obviously it's long and it extends above the thalamus, right here in the parietal lobe. And then we talk about the tail. Tail is long and it's tapering, and at the end of the tail, there is a connection to the amygdaloid nucleus, and this is all present in the temporal lobe. So this is exactly the same diagrams taken from Google. And then we talk about the lentiform nucleus. Now this is important. Lentiform nucleus, as I told you, it includes putamen as well as globus pallidus. So the outer one is basically the putamen. This is putamen, and this is globus pallidus. And the globus pallidus apex is trying to get into the internal capsule and hence making the angle the genu. It's right against the genu. This is genu of the internal capsule और ये इसके against है. ठीक है जी. Now most important terminology जो आपको पता होनी चाहिए एग्जाम पॉइंट ऑफ व्यू से BCQs में आ सकती हैं, वो ये प्लीज गौर से सुन लीजिएगा. If this is globus pallidus और ये putamen, इन दोनों के बीच में गैप नजर आ रहा है. This gap is basically known as the lateral medullary lamina. फिर जब मैं प्यूटामेन से बाहर जाता हूँ तो ये लाइन दिख रही है. दिस इज क्लोस्ट्रम. इस क्लोस्ट्रम के बिल्कुल बराबर में जो गैप है, दिस इज नोन एज द एक्सटर्नल कैप्सूल. यहाँ से भी फाइबर्स रन कर रहे हैं, और क्लोस्ट्रम से मैं बाहर जाऊंगा तो आपको टी शेप का एक गायरस दिख रहा है, दैट्स इंसुला. इन दोनों के बीच में जो गैप है, दैट्स कॉल्ड द एक्सट्रीम कैप्सूल. सो फार आपकी जो ओरिएंटेशन है फ्रॉम मीडियल टू लैटरल, दैट्स ग्लोबस पलाइडिस, lateral medullary lamina, putamen, external capsule, claustrum, extreme capsule, insula. But if I go towards the globus pallidus again, तो globus pallidus में हमें नई चीज ये पता चली. globus pallidus भी दो होते हैं अलग से. एक होता है medial globus pallidus, एक होता है lateral globus pallidus. एक इसका medial segment है और एक इसका lateral segment है. इन दोनों के बीच में जो लाइन दिख रही है, this is another line that's called the medial medullary lamina. So now if I revise it, so this is internal capsule, medial globus pallidus, medial medullary lamina, lateral globus pallidus, and we have lateral medullary lamina, putamen, external capsule, claustrum, extreme capsule, and insula. So ये सारी चीजें जो है ना BCQ में आ सकती हैं. In terms of, we can write down the definition of it, and we can ask you what are we defining. Right now we can ask you which of the following statements correctly describes, for example, extreme capsule. तो ये आपको correct चीजें ढूंढनी होंगी BCQs में. ठीक है, आगे चलते. Then we have a amygdaloid nucleus, which is a very smaller nucleus towards the end of the tail of the chordate nucleus. This right here, and it is considered to be part of the limbic system because it's connecting the limbic system to the basal nuclei, so that you can have the memory and the past experiences to the motor activity as well. These are the different connections. This is just the diagram is just telling that everything is connected to the basal nuclei, by be it caudate, be it globus pallidus, be it putamen, be it midbrain. So everything is interconnected, be it thalamus. If I talk about the circuitry, so this is striatum. Striatum, remember I told you striatum means it includes caudate and putamen. So yeah. So whenever a signal, there are three ways the signal can come to the striatum. One, it can come from cerebral cortex. Other, it can come from thalamus, and the later one, it can come from substantia nigra as well. ठीक है. अब जब ये पहुंचते हैं तो they can go directly back to the substantia nigra for the feedback mechanism, or they can go to the lateral segment of the globus pallidus as well as on the medial segment of the globus pallidus. So from lateral and the medial aspect of the globus pallidus से कहाँ निकलेंगे आगे ये देख लेते हैं. That's the globus pallidus paleostriatum circuitry. अब जब यहाँ पहुंच गए तो from here they can go to thalamus and they can go directly to the subthalamic nucleus, and this is all about it. So this is the circuitry which is going on. यहाँ पे हमने इस डायग्राम में इनके सिर्फ और सिर्फ न्यूरोट्रांसमीटर बता दिए which you should know a little bit about it. For example, cerebral cortex से glutamate आता है, corpus striatum पे जाता है. Substantia nigra से dopamine आ रहा है which is going to the corpus striatum. Corpus striatum से globus pallidus पे जाने के लिए हमारे पास GABA यूज करते हैं, as well as अगर substantia nigra की तरफ जाना है, corpus striatum से उल्टा जाना है, तो we can use GABA, substance P as well as acetylcholine. And spinal cord से और brain cells से लेकर आ रहे होते हैं, that they use serotonin for this, and glutamate is also used when it's coming from the subthalamic nucleus. So this is all about the connection. Most importantly, जो आपको functionality समझनी है बहुत जरूरी है. Clinical cases in case अगर आ जाए एग्जाम में तो वो किस तरह solve होते हैं. So please remember one thing, that the basal nuclei is only and only responsible to regulate the voluntary movements. They cannot initiate the voluntary movement. They can only regulate already initiated movement. तो अगर एक पेशेंट है जो मूवमेंट इनिशिएट नहीं कर पा रहा तो उसके बेसल न्यूक्लिया में मसला नहीं है, उसके टीलेंसेफलॉन में मसला है, उसके सेरेब्रल कॉर्टेक्स में मसला है जिसकी वजह से वो पैरालाइज हुआ. लेकिन अगर वो मूवमेंट इनिशिएट कर पा रहा है बट उस मूवमेंट में कोई कोऑर्डिनेशन नहीं है, कोई रेगुलरिटी नहीं है, या वो बिल्कुल सीधी मूवमेंट नहीं है, इट्स नॉट अ फाइन मूवमेंट, ठीक है, और रिपीट नहीं हो सकती वो मूवमेंट, तो इसका मैं समझता हूं बेसल न्यूक्लिया में प्रॉब्लम. As well as another thing, it also helps in learning the motor skills. Apart from that, so this is the most important thing. The dysfunction of the basal nuclei cannot cause paralysis as well as sensory loss as well as ataxia. Ataxia होता है cerebellar disorder की वजह से, sensory loss and paralysis होती है आपकी telencephalon की वजह से. So अब अगर functionality में problem आ जाए basal nuclei की तो क्या हो सकता है? They can only and only cause abnormal motor control, that is known as a dyskinesia, ठीक है, and they can cause alteration in muscle tone. For example, they can cause hypertonia as well as hypotonia. तो यहाँ से जो clinicals निकले हैं वो ये निकले. There's a term that's called chorea. Chorea is derived from choreography. Choreography is basically a form of, it's the basics of dance, right? तो इसमें क्या होता है कि the patient has symptoms, इसमें वो involuntary, quick, jerky and irregular movements करता है, which are non-repetitive. It looks like a dancing movement. That's why we call it as chorea. Then there's another disease that's called Huntington's disease. Huntington's disease is basically another disease which is an autosomal dominant inherited disorder. इसमें होता है कि GABAergic neurons deplete हो चुके होते हैं, which basically leads to choreiform movement. This is again a similar thing like this, and it has basically extremities and face में भी हो सकती है. And then they can also have progressive dementia. Dementia is another word for memory loss. So they have loss of memory as well as intellectual capacity. So this is where the amygdaloid nucleus comes in. This is Parkinson's disease symptom. This is basically substantia nigra is responsible to secrete the dopamine. And when substantia nigra is not working, the dopa is not there, which leads to a lot of stiffness and rigidity in the whole body. And the characteristic feature is basically the resting tremors. So बैठे बैठे इनको tremors पड़ते हैं. That is a spot on diagnosis of Parkinson's disease. So I hope the basal nuclei is cleared here. Now we'll move towards the internal capsule. Now, internal capsule is another thing. You know आपको क्या चीज़ है? It's basically present medial to the basal nuclei and it's present lateral to the thalamus. So yeah, the internal capsule. So this is the internal capsule as I told you earlier. It has an anterior limb, posterior limb, and genu. Genu is the angle, anterior limb era, posterior limb era. This is your basal nuclei, and this is the thalamus. Right? This is the pathway. This is caudate nucleus, head. So as you see in the anterior limb, you can see three major tracts. Basically, two major tracts. One right in the center is the thalamic radiation, anterior thalamic radiation is coming from the thalamus. So anything which is coming into the thalamus, if it has to go to the cerebral cortex, it will pass through this antithalamic radiation. And whenever it's coming to the thalamus, it will come through the posterior thalamic or anterior thalamic radiation, which is right here. Okay. On the other hand, in the anterior limb, these are basically the frontopontine as well as corticofugal fiber. These are the motor fibers which are going on. And if I go here, these are the corticospinal tracts, where F represents face, A represents arms, T represents trunk, and L represents legs. So ये इस हिसाब से these are the motor tracts and these are the sensory tracts. This is all you need to know about the internal capsule. Then we talk about the thalamus. Now please remember, thalamus is you need to know the situation कहाँ पे रखा हुआ है, and you just need to know the group of nuclei which are present there और उनके functionality पता होनी चाहिए. तो in exams we can ask you कि भाई एक patient है उसको ये मसले तो बताओ कौन सा thalamus का nucleus क्या. But most importantly, thalamus, please remember, I hope किसी ने कभी ना कभी समझाया हो. तो उसमें thalamus is basically the major sensory relay. तो जितनी भी sensations आ रही हैं, they eventually are received by thalamus and then it through internal capsule it goes to the cerebral cortex. So let's talk about thalamus. Thalamus ये पढ़ा हुआ, ये डायग्राम कभी कभी एसपी में आ जाती है तो याद रखिएगा. ये पढ़े हुए दो थैलेमा है, इनके बीच में कनेक्शन होती है. ये आपका कॉर्डेट न्यूक्लियस आ रहा है ऑल द वे घूम के. ठीक है, आगे चलते हैं. थैलेमस में बहुत सारे न्यूक्लियाई होते हैं, उनके ग्रुप्स बनाए हुए हैं. हमने एक डोर्सल ग्रुप बनाया हुआ है which includes the medial nucleus right here. There's a lateral dorsal nucleus right here. There's a lateral posterior nucleus which is right here. Then we have a ventral group of the nuclei which has a ventral anterior nucleus. You know, we have ventral lateral nucleus right here, and then we have the ventral posterior medial nucleus which is right here. As far as the thalamus shape is concerned, it looks like an egg. एग में आपको पता है आगे से पॉइंटेड पार्ट होता है, पीछे से थोड़ा फ्लैट होता है. तो जिसका आगे का पॉइंटेड पार्ट है वहाँ पर एंटीरियर न्यूक्लियस होता है, एंड जो पीछे से राउंडेड पार्ट है दैट्स कॉल्ड पल्विनार. और पल्विनार के साथ कनेक्टेड है मीडियल जेनिकुलेट बॉडी एंड लैटरल जेनिकुलेट बॉडी. और आपको पता है लैटरल जेनिकुलेट बॉडी इज फॉर विजन एंड मीडियल जेनिकुलेट बॉडी इज फॉर ऑडिटरी पाथवे. जो आप सुनते हैं वो यहाँ जाता है, जो आप देखते हैं वो यहाँ जाता है. So this is the table that describes everything. Posterior ventral nucleus, that's basically for relaying of the somatosensory impulse that includes touch, pressure, pain, temperature, proprioception, kinesthetics of the trunk and the limb, as well as from the face. Lateral ventral group जो था nucleus का, so it relays the proprioception information from the voluntary motor function, while the dorsolateral nucleus was there for speech and other complex integrated functions. Pulvinar is there for integration of the auditory and visual information which is coming through medial geniculate body for the auditory impulse and lateral geniculate body for the visual impulses. So that was all about the diencephalon. I hope you're able to understand this. If you have any questions, do ask me. Thank you.